All right, so just going to start with checking for any asymmetry, any bulges, swelling of the skull. Take a look and see if there's anything swollen. Let's check your preauricular lymph nodes, postauricular, nothing there. Let's check the occipital back here, tonsillar. Okay, just relax there. Good. Head up the wall and just keep looking at that one point. Adjust this ophthalmoscope. Switch eyes here. Red light reflex is present. I'm going to come closer. Let me know if this is painful at all. I can always adjust my technique. Okay, I'm just starting with looking at your external ear and not noticing any discharge or redness, any nodules, lumps. Let's take a closer look now. Okay. A little bit of a buildup of serum and wax, but not too bad. Go a bit deeper. Is this okay?
Yeah.
Just want to listen here a bit longer. Good. And then this side one time. Good. Then I'm just going to lift up your shirt. Go underneath right there. So take a deep breath in as well, and then hold. Okay. And everything looks symmetrical. I don't see any bruising or discoloration. All right, let's have a listen in your abdomen. Sounds like you're a little bit hungry.
Yeah. See.
Okay.
See.
Today's video is kindly sponsored by Care Of. As I'm transitioning out of a laid back and slow summer into quite a busy fall season, it's more important than ever for me to take good care of myself. That's why I'm so happy to be using Care Of. Care Of is a personalized supplement subscription service that I've been using for the past 10 months. I love how my Care Of supplement routine evolves with me. Every month, I retake Care Of's quiz and I select the health and wellness goals that I am prioritizing for the month. For September, my goals are energy, stress, sleep, joints, and fitness. In my personalized vitamin pack, I have magnesium, which supports muscle recovery, sleep, and energy levels. Turmeric for supporting stress, healthy joints, and mood. And vegetarian collagen for joints, which I have been using every day for the past 10 months, and it has been so great for improving my joint comfort and flexibility. I love that all of Care Of's products are formulated with care by naturopathic doctors. Care Of makes it so easy and fun to get into a healthier routine. So go ahead and take Care Of's quiz and see what vitamins and supplements they recommend for you. You can go ahead and click on the link in my description box and use the code Semide, all caps, for 50% off your first order with Care Of. Hi, Dia.
Hi.
It's nice to see you again. It's
Yeah.
been so long. According to my records, it's been 3 years since you've been in the office.
It's been a while.
Yeah, how have you been?
I've been good.
Yeah?
How are you?
I'm doing good. It's been busy as usual, but it's really nice to see you. So,
Seeing you too.
are you still keeping up with your healthcare even though you've been away?
Yeah, I've been doing mostly walk-ins when I need to.
Yeah.
Yeah.
Where are you normally located these days?
I'm traveling here and there, so
Okay. Yeah.
different countries, yeah.
So is Ontario still your home base, or are you?
It still is,
It still is at the moment. Okay. Well, do let me know if that changes so we can, alter our records around that. But in the meantime, happy to still be your doctor. All right. So today I have you down for a full physical exam, head to toe. I'm really going to go in depth and check all your systems and see how your overall health and wellness is. Okay.
Sounds good.
Yeah. So let me ask a few questions about your history. First of all, any changes to your medical conditions?
There's nothing I can think of. Yeah.
Okay. No changes. Any new medications you're taking?
No medications, but supplements.
Okay, tell me about which supplements you're taking.
So I've been using Care of, and within the packets currently, I have magnesium, probiotics, rhodiola,
Yeah.
keratin, and I
Keratin,
think that's it. Oh, apple cider vinegar.
Apple cider vinegar. Okay. Are you smoking at all?
No.
No smoking. Okay. Are you drinking any alcohol?
Sometimes, like a wine of glass or two every other week.
Every other week. Okay, so that's pretty reasonable. Now, do you drink any caffeine? Caffeinated
I've been
beverages?
cutting down on caffeine, which I'm very proud of.
Yeah, that's awesome.
I've been switching out my morning coffee for matcha, and that's been great. Yeah.
Is there anything else you'd like to share with me before we start the physical exams?
Oh, well, my sleep hasn't been very good these days. I've been struggling, I would say, like this year. I mostly struggle to fall asleep. That's my problem area. Yeah, and I used to take naps, but that's like not really approachable for me at the moment.
And you said that started this past year, so about a year ago?
Yeah,
or?
it's been like a year, I would say.
A year. Do you know what triggered that to start?
I guess I would say stress with, all of these projects I have going on, and overexerting myself with some, and I've been doing a lot of inner work. Sometimes, that brings up a lot of emotions, so it's a lot for my system.
Absolutely, yeah. I can see how the stresses from different parts of your life can all kind of add up together and then disrupt your sleep as well. But, we really need the sleep in order to restore ourselves and then, raise up our resources again, like fill up our cup, so to speak. So, is there anything that you've tried to help promote better sleep for you?
At the moment, I'm using Kara Sleep Blend. It has melatonin and ashwagandha, I believe. Yeah. I was wondering what your thoughts were on that.
Yeah, I really like that supplement, actually. I really like their blend of valerian, melatonin, and ashwagandha. So ashwagandha is used in Ayurvedic medicine. I don't know if you know that. It's an adaptogen. It helps to reduce stress and helps to calm the mind. So then it promotes sleep. And then melatonin, of course, also reduces the time that it takes for someone to fall asleep. It's very important in regulating the circadian rhythm, so I imagine that could be really helpful for you. It's been helpful for a lot of people so far. Yeah.
Okay, good to hear.
Yeah. So keep me posted on how that goes for you.
For sure.
All right, so is there anything else we should address, or can I go ahead and get started on the exam?
Yeah, not anything at the moment.
And I can keep asking questions throughout the exams, and if you have anything you want to just say, just at any point, you can just share.
Okay, sounds good.
Have you place that under your tongue and then just hold it? Just gonna bore your arm here. Okay, just relax your arm. There, it's perfect. Bring a dark level there. Okay. 36.89, perfect. Okay. So that was 105/67, and I have in the records that normally your blood pressure is a little bit on the lower end, and that's normal for you. Okay. Now, have you still been having any like low blood pressure spells? I recall that happening for you last time we spoke. No,
not really. Not in the recent years.
Okay, good. Just make a note of that. 8 degrees Celsius. So that's great. And then I'm just going to check your pulse and breathing rate. Perfect. Okay, so pulse is 58 beats per minute, and your breathing rate is 12 breaths per minute. That's good. All right. All right, so we're going to start at the top of your head and check your scalp and your skull, and we'll move down. All right, so just going to start with checking for any asymmetry, any bulges, swelling of the skull. Any areas that are soft or spongy can be a concern. don't feel that. Okay. Now I'm going to note the distribution of your hair, see if there's any areas that are patchy, uneven, any signs of alopecia. Do you have any concerns with your hair, Ediya?
I've actually lost a lot of hair in, I would say, like the past 2 years. I was a little bit concerned initially.
Yeah.
But it seems to be, my hair seems to be fine at this time.
Okay, so did you find that it stopped shedding as much, or that it kind of grew back? What changed?
There's less shedding now. And I wonder if it's just like, thinning of hair as I'm getting older. Or it could be stress.
Yeah, normally we shouldn't see much thinning at all of hair until after 35 years old.
Oh, okay.
So, you're not quite there yet. So that is a little bit concerning for me.
Okay.
I'd probably attribute that more to stress and kind of imbalance in your hormones. So we can definitely, I will order up a blood panel to take a look at your thyroid hormones, and we can also look at your testosterone, estrogen, progesterone levels and see where they're at and where you are at in your cycle. Have you noticed any changes in your menstrual cycle that are concerning?
I would say they've actually gone better for me.
Okay.
In the sense that I don't experience too much. I don't really experience cramping at all anymore.
Yeah.
So they've felt pretty regular and gentle for the most part.
That's great. I'm glad that's been a positive change for you. Okay, so I just took a look out all over. I don't see any patchy areas. I don't see any thinning. It looks very healthy and very, very full. Looks like you're doing a great job. Great level of moisture as well. And also didn't notice any concerning like nevi or dermatitis or anything underneath. So that's great. Yeah, you're doing great. So while I'm back here, I'm gonna start taking a look at the skin.
Yeah.
I'm just gonna hold up your hair like that and just take a look at the skin. I'm looking at levels of moisture, the texture, any discoloration, any nevi that are concerning. There's a few here, but they don't seem abnormal. Okay, let's take a look at your arms. Okay, also noting the temperature, nice and warm down there, that's great. Yeah, I remember having my notes last time that you had sort of colder extremities, colder hands and feet, but it seems like that's improved as well.
I think so, yeah.
That's great. Cold hands and feet can be a sign of thyroid dysfunction. And, could also, if that's just always been the way for you, it's not anything too concerning. Okay. So actually, I want to check your nails too. Just checking the capillary refill, any clubbing, pitting. Looks good. Just check that nevi right there. That's great. Okay, great perfusion. Signs of hypoxia. Take a look at your hand here a bit more closely and the nails as well. Yeah, it's great. Capillary refill under 3 seconds. Yeah, good color there. It's wonderful. Have you experienced any eczema at all?
On my neck.
On your neck?
Yeah.
Okay, the front of your neck?
Yeah, just the front over here. especially when I put perfume on, they're quite sensitive. Or my neck is quite sensitive.
Yeah.
And but it comes and goes, the eczema.
Okay.
So I've just been, making sure that I put moisturizer on every evening.
Yeah.
To keep it moisturized.
So if it's in response to the perfume, that might be more like a contact dermatitis, possibly.
Okay.
Yeah, if it's just reacting to what you're putting on. Eczema tends to be more like allergic, autoimmune sort of standpoint. And I find a lot of my patients are really flaring up right now because of summer allergies, the weed pollen, ragweed pollen especially going around. Have you noticed any signs of allergies for you? Stuffy nose, watery eyes? Okay, no. Awesome. And I will take a closer look at your eyes and ears as well.
Okay.
Let me take a closer look at your neck, Ediya. And I also want to take this chance to just check your lymph nodes as well. Have you been sick recently with cold or flu or anything?
I got a little sick on Monday.
Okay.
Almost to a fever, and then it kind of subsided on its own.
Okay. All right. Let's take a look and see if there's anything swollen. Let's check your preauricular lymph nodes. Post-auricular, nothing there. Let's check the occipital back here. Tonsillar. Okay, why don't you just relax there? Good. There's some mandibulars, mental. No enlargements there. Let's check the posterior cervical. Anterior cervical. Okay, we're going to go a little bit deeper. Yeah, great. Let me know if anything's tender, okay? Yeah, perfect. Okay, now we're just going to I'm just going to have you shrug up and check the subclavicular here. Okay, back down. And for clavicular. All right, now I'm going to check under your arms, okay? Let's check the pectoral. Central. Subscapular, lateral, nothing alarming there. Okay, let's check your pectoral, central, subscapular, and lateral. Okay, great. Okay, let's take a look at your skin here. It's feeling the temperature. And is that something that happened recently?
Yeah, a couple months ago I fell on some gravel.
Okay.
Yeah.
Did you like have an open wound with that?
I don't think it was too deep. It healed within a week.
Okay, so just a little bit of scarring left. Okay, I'll make a note of that. A little bit of hyperpigmentation there. Looks like it might just be like a mosquito bite or something. Yeah.
Probably.
Okay. Feet are a little bit cold this time. Make a note of that as well. Okay. Otherwise looks good. Okay, I'm just gonna check to see if there's any edema in your legs. No, not at all. That's great. There's enough light there. And it looks quite small, so it's not concerning. All the same color as well. The borders appear to be regular. That's great. It's like cold here too. Let me check your capillary refill. Check it on this side too. Okay, perfect. All right, Ediya, let's take a look at your face and your eyes. So I'm just gonna have you close your eyes. I want to palpate the lacrimal apparatus, see if there's any swelling. No. And then the gland here, the puncta, no swelling at all. That's great. Yeah. Okay, you can open back up. Let's do some tangential lighting into the eyes and see if there's any shadows, any nicks, tears, discoloration. Check the other side. No shadows of the iris, and the cornea is transparent. There's no injuries there. All right. So I want to check your pupillary reaction. So just go ahead and look straight ahead right there. Let's take a look at this side. Other side. So direct reaction to light is intact. Now we're going to check consensual. That's great. Other side. Wonderful. Okay, pupils are equal, round, and reactive to light. Just make a note of a few things. Right, palpate your sinuses. Start with the frontal here. Any pain? Can I do this? Okay. Any pain or tenderness here?
No.
What about over here?
No.
Okay. Now let's do the paranasal. Pain or tenderness?
No.
What about here?
No.
And here?
No.
Okay. Do some illumination. Okay. Yeah, I don't see any obstruction of the sinus. It's amazing. Open up your mouth and illuminate. Looks good there. One more time. Yeah, looks great. Okay. Let's take a look at your conjunctiva real quick. See if there's any redness there. Just look up for me. Good. And then look down. Okay. Yeah. Erythema of the conjunctiva. Sinuses are clear. Transillumination clear. No pain and tenderness upon palpation and percussion. Okay. All right. Okay. So I want you to just look at the tip of this, all right? And just follow with your eyes. Do not move your head, okay? Good. Wonderful. Let's try that one again. Looks great. Awesome. Okay. So I was just testing your cranial nerves 3, 4, and 6 there. They all appear to be doing well. And there's also no nystagmus at the end, which is just a little bit of like twitching at the end. And I didn't notice any of that. So that's great. Now I'm going to have you take a look there again and just follow with your eyes, all right? Just going to check if accommodation's working well here. Wonderful. Okay. Reaction, accommodation are good. Ediya, can you remind me if you wear glasses or contacts?
I don't.
You don't? Okay. All right, so I want you to close one eye. Doesn't matter which one you start with. Yeah. And I'd like for you to read the lowest line that you see.
4, 2, 8, 7, 8, 9.
Okay, great. Now switch over.
3, 9.
Okay, great. Now switch over to the other eye and read that same line backwards.
9, 3, 7, 8, 2, 4.
Perfect. Yeah, 20/20 vision. Both eyes. Okay, we'll do visual fields and then ophthalmoscopy. So we're going to be doing visual fields, checking the peripheral areas of your vision. So I want you to just close this eye right here and keep this eye on mine. I want you to let me know when you see the wiggling tips of my fingers. Just say now whenever you see it, okay?
Now. Now. Now.
Great. And then just keep that eye closed.
I react really slowly.
Sorry, the same eye.
Oh,
yeah. Yeah.
Now.
You're doing great. I can go slower if that helps.
Okay, yeah. Now.
Okay.
Now.
Okay. So now let's switch eyes. Perfect.
Now. Now.
I'm going to come a little bit closer.
Now.
Good. Same eye.
Now. Now.
Okay.
Now.
Wonderful. Yeah, that's great. So all the peripheral fields are intact, each quadrant. All right, let's do ophthalmoscopy. Okay, so you remember this one?
I think so.
Yeah, so this is a panoptic ophthalmoscope. Yeah, it works great. And I'm just going to use it to take a look inside your eye. So I'm looking at the retina, I'm looking at the macula, looking at your optic disc, and I'll tell you more about what that is. Okay. So I want you to look straight ahead at the wall and just keep looking at that one point. Adjust this ophthalmoscope. Switch eyes here. Red light reflex is present. I'm going to come closer. Okay. All right. Okay. Now let's look at your right eye and just move your head this way. Look at one spot again right over there. And then I'll just adjust to that eye. Red light reflex is present. Okay, wonderful. Okay, so I've noticed that your optic disc on both sides look really good. Clear outline, no bulging. The cup to disc ratio is also good, under half, so I don't suspect any glaucoma or anything like that. Let me take a closer look at the blood vessels, and then I'm going to have you look into the ophthalmoscope for just a second to take a look at the macula and fovea. I've also noticed that the retina looks a nice creamy orange, which is a good color. I don't notice any spots, but I'll keep looking. I'll move on back to this eye. Look straight ahead. And look into the ophthalmoscope. Great. Yeah, your blood vessels are not nicked. They don't seem to be enlarged. And your macula fovea doesn't have any kind of signs of degeneration, which is great. I don't expect that at your age anyway. Let's take a look at the other eye. And look into my little scope. Okay, good. Same findings on the other side. Clear outline. Okay. Ediya, I'm just going to do a very basic ear exam on you that I do on everybody. I recall that you have some loss of hearing on your right ear.
Yes, the right ear.
Okay. Have you been seeing an audiologist about that?
About every 5 years.
Okay, great. All right, so yeah, this is very basic. It's just routine, but if I have any concerns, I can always just contact your audiologist. I think we have him on your medical history. So I'm just gonna have you. Well, let's take a look and see. Check if there's any pain. Any pain when I do that? When I press on your tragus? There. Pain?
No.
What about when I pull on your pinna here?
Nope.
Okay, other side. There?
No. No.
Okay. Okay, so this is the Weber test. I'm just going to hit the tuning fork. Let me know if you hear it first on your right ear, your left ear, or both.
Okay.
At the same time. Yeah. Like, where do you hear it first?
I'd say both, but it's definitely louder in my left.
That makes sense. Okay. Now let's check your left ear first, and then your right ear to see how it's doing. So place that there. Let me know when you stop hearing the sound, okay, Ediya?
Okay.
You still hear it?
Okay, stopped.
Okay, do you hear this?
Yeah.
All right, close your eyes if you don't mind. Just let me know when you stop hearing it.
Stopped.
Okay, great. Let's check the other side. Close your eyes. You hear that?
Mm-hmm.
Let me know when you stop hearing that.
Now.
You hear that?
Yeah.
Close your eyes. Let me know when you stop hearing it.
Now.
Great. Okay. So now, let's take a look inside your ear. I have a fresh tip there. And start with your left ear. Let me know if this is painful at all. I can always adjust my technique.
Okay.
Okay, I'm just starting with looking at your external ear and not noticing any discharge or redness, any nodules, lumps. Let's take a closer look now. Okay. A little bit of a buildup of serum and wax, but not too bad. Go a bit deeper. Is this okay?
Yeah.
A little bit of erythema closer to the tympanic membrane. And just adjust my technique and try to visualize the tympanic membrane, your eardrum. Okay, I can see it. Cone of line is conflict is present into your upper area. And it's a little bit cloudier than normal. Bony landmarks are present. Vessels appear to be a bit injected at the top. Okay. Have you ever had infections in this ear here?
Not that I remember.
Okay. It's a little bit cloudy underneath the tympanic membrane. It's not as translucent as we would see in a healthy ear. So, yeah, there's just a little bit of probably some edema buildup back there, but nothing too concerning, especially if it's not bothering you. It doesn't look like it's an active infection, but yeah, we'll just keep an eye on that one.
Okay.
There's no bulging of the membrane, so there isn't any swelling there. Okay, external ear looks good. No bumps, nodules, no discharge. Let's go closer. Okay, I don't see any serum and wax on this side. Bony landmarks are present. Everything is flesh-colored. Vessels don't appear to be injected. Cone of blood is present. Anterior bottom quadrant. Nice and translucent. No bulging. Okay. So this ear here looks completely healthy inside. I don't see any signs of redness or any injected vessels, and the tympanic membrane is nice and translucent, so comparatively healthier than that one there. So just make a note of that. Slightly cloudy behind the tympanic membrane. Coniflate anterior top quadrant. Vessels injected. Okay. All right, let's take a look inside your mouth. I actually want to take a look at your nose first. Can you plug one side of the nose and breathe out? Okay, nice and patent. Other side. Good. Okay, let's take a look inside. I'm just going to lift up. No discharge or buildup, and it doesn't appear to be red. That's good. Any issues with your nose at all?
No.
Okay, good. Let's take a look inside your mouth. Open up. Just going to insert this. Take a look at your teeth. Yeah. No concerns, no cavities with your teeth. How often do you see a dentist, Ediya?
Half a year.
Okay, so let me take a look at your mouth. Check your teeth first. Don't see any signs of cavities. Your gums look nice and pink and healthy. Don't seem to be receded. Okay, open up. Take a look at the top. Good, okay, can you stick your tongue out, please? Okay, then tongue up. Just an oral cancer check. And to one side. Good, other side. Okay, great. Now I want you to just say ah. I'm going to take a look at the back of your throat. Yeah. Okay, so the tonsil on your left side appears to be enlarged, and there's also a little bit of buildup back there. Let me just take a look. A bit more. Yeah, just slightly. And the other side is not enlarged. Say ah one more time. Yeah, but I don't see any discharge or redness in the back of your throat. It's just that tonsil.
I do feel a bit of soreness in this moment.
On this side right here?
Yeah.
Okay. Let me make a note of that. And you said you were having a fever a few days ago.
It's building up to it and didn't really happen.
Okay. And there's just like a white deposit that I also see. Make a note of. And you're saying there's some tenderness on that side. Okay.
Just like when I swallow, I feel it.
Okay. Just check that lymph node one more time here. Like when I do that, does it feel tender, or is it more so back here?
Yeah.
Back here? Yeah, there's no enlarged lymph nodes here, but definitely something to pay attention to. Do you do saltwater gargles at all?
Sometimes when I remember to.
That would be a good idea to just keep that going. It'll just help to, clear and disinfect the back of your throat. Yeah. Try to do that in the morning, at night, if you can. Okay. More often is better, but at least once in the morning, once at night. Okay. And I'll make a note of that for you, and we can send you home with like a write-up of suggestions that we have. So. Okay, great. How are you doing?
Good.
It's a really long exam, but you're doing really great.
Feeling very relaxed.
Okay, good. So I'm just going to have you turn around. We're going to start listening to your lungs. Okay. All right, so move your hair out of the way. Okay, Ediya, so when the head of my stethoscope touches your skin, I'd like you to take a deep breath in and then back out, okay? Okay. Is it okay if I can you lift up your shirt? I'm just going to access. Here we go. Good. Good. And just on the side here. Good. Can you give yourself a hug? Just want to listen here a bit longer. Good, and then this side one time. Good, then I'm just going to lift up your shirt, go underneath right there. Great. Wonderful. Yeah, all the lung fields so far sound clear. I want to try 2 techniques. So we'll start with whispered pectoraloquy. And you're just going to say 1, 2, 3 in a whisper voice. And I'm going to keep listening in.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Just going to go down here.
1, 2, 3.
Okay.
1, 2, 3.
Wonderful. So in that technique, I was listening to see if the whisper sounded louder, which could suggest that there's either fluid buildup or a mass in your lungs, and that I did not hear any of that, so that's great. I'm going to go ahead and percuss, and so you don't have to do anything here. I'm just going to be percussing around. Continue to give yourself a big hug. There you go. I'm just going to lift this up a bit. Wonderful. Okay, now I'm going to check for chest expansion. So, okay, take a deep breath in and out. Great, so that's symmetrical. Wonderful. So I'm just going to locate thoracic vertebrae 10. So this is L4, L5. Can you bend over for me just a little bit? Perfect. 4, L5, 3, L2. Okay, you can sit back up. Great. So, yeah, you probably can. Right, so I'd like you to take a deep breath in and then hold your breath, okay? Okay, go ahead. Okay, you can release your breath. So take a deep breath in as well and then hold. Okay. Now you release. Yeah, great. Okay, so now I'd like you to be able to release a full breath and then hold that. Can you do that for me? Okay. Let me know. Okay, and then hold. Great. I'm going to check the other side. Okay, so whenever you're ready, deep breath in, release the full breath, and hold. Okay, great. Go ahead and breathe normally. So let me measure that. 7 centimeters on both sides, which is amazing. Normally we see 3 to 5 centimeters as the range where the diaphragm moves up and down, but you've got 7 centimeters, so you've got really great capacity to take in a deep breath and let it out. Is it because of, do you do meditation and deep breathing exercises?
I do, yeah. So that's good to know.
Yeah, it's really incredible, and just overall, your fitness, your lung capacity is just remarkable. Keep that up. That's great. All right, Ediya. Let's have a listen at your lungs from this perspective. In the front. So again, I want you to take a deep breath in and out whenever my stethoscope touches your skin, okay? Lovely necklace. There's the other side here. now can you lift your shirt just right under your chest? Right there, perfect. Okay. Wonderful. All your lung fields on the anterior side are also clear, no extra sounds. So let's do a little bit of percussion here. Listen for resonance. Move your necklace over. And just down here. Other side. Okay, great. Let's listen to your heart. Okay, I'm going to start on kind of second rib area on this side. And just breathe normally. I'm just going to listen to here. And down here. Very strong heart. Let's listen to see if murmurs or valve issues. Good. Great. Clear S1 and S2 sounds, no extra sounds, no murmurs, no issues with your valves. So listen to your carotid arteries. Good. Perfect. Okay, we just inspect your abdomen. Umbilicus looks good. Everything looks symmetrical. I don't see any bruising or discoloration. All right, let's have a listen in your abdomen. Okay. Sounds like you're a little bit hungry. While I'm here, I'm going to listen to your abdominal. Just palpate your. Can you bring up your legs? Just bend your knees right here. Yeah, just make it easier. I'm gonna feel for your abdominal aorta. It's not really on the. There it is. See how large it is. Just gonna mark it, okay? Well, it feels very small to me. I don't think I need to mark it. It's definitely not enlarged. Yeah, I really only feel it on this side there. Okay, let's have a listen. It sounds clear. Listen to the renal arteries. Great. I'm going to do some percussion. Let me know if you feel any pain or tenderness at any point. Ediya, how are your bowel movements like? Are you having them every day?
Yeah, mostly.
Mostly every day, like in the morning?
Morning.
Morning?
Yeah.
Are there some days when you miss bowel movements? Okay. Yeah. All right. So, yeah, just make sure you stay hydrated. It sounds like you're taking magnesium. That can certainly help keep things moving. Making sure that you're eating enough fiber in your diet, especially soluble fibers, which come from fruits and vegetables. Fruits like apples and vegetables like onions are a good source as well. Yeah, but if you ever have any issues with that, feel free to contact me. I can give you more tips and suggestions.
Sounds good.
Okay, so now I'm going to start palpating. Let me know if you feel any pain. I'll start superficial here. Any pain anywhere? Okay, I'll go a little bit deeper. Looks like you're guarding a little bit there. Is there any pain there at all? Okay, that seems good. All right, let me go ahead and palpate the liver. So I just want you to take a deep breath in for me and out. Yep. It's non-palpable. Okay, we're going to check the spleen here. Okay, take a deep breath in and out. Okay, one more time. Deep breath in and out. Okay, that's also non-palpable. Let me just do the Castell sign just to be sure. And take a deep breath in and out. Great. Yeah, your spleen is not enlarged at all. Okay. All right, so I'm gonna go ahead and check your peripheral pulses down on your legs, and then we'll finish up with a neurological exam. You're doing great. I'm gonna check your femoral pulse here. That's great. And then I'll check your popliteal pulse. underneath. That one's doing good also. Risk 3+. Let's do that side here. Great. And now let's check your dorsalis pedis. And you can let your feet down. Great. And then your tibialis posterior right here. Good. And then I'm just going to do the Babinski reflex. Good. Great. And do a reflex here as well. Good. One here. Good. And then let's check this side here. Okay, good. So I just want to check your dermatomes, which is the parts of the skin that are innervated by different nerves from your spine. So just let me know if you feel the same sensation on both sides or if it feels different at all, or if there's any strange sensations that are picking up. Okay. Or even if a sensation is absent on one side, I'd like to know. Okay.
The same.
Okay, great.
Same.
Okay.
Same. Same.
Okay, perfect. All right, Ediya, I'll have you sit up and we'll finish the rest of your neurological assessment. So I'll continue the dermatome exam on your arms. Yes, keep your eyes closed. Let me know if you feel same on both sides or different. I'm just going to brush your hair back there, okay.
Same. Same.
Okay.
Same.
Great.
Same. Same. Same.
Perfect. While we're here, let's check your myotomes. So these are the nerves that are innervating the muscles that come out from the spine. So I'm going to have you resist against my push. Okay, we're going to hold it for 5 seconds. 1, 2, 3, 4, 5. Then back into my hand. 1, 2, and with just your head. Yeah. 1, 2, 3, 4, 5. Great. And now onto this side. 1, 2, 3, 4, 5. Other side. 1, 2, 3, 4, 5. Wonderful. And I'll have you shrug up into my hands. 1, 2, 3, 4, 5. And go drop. It's very strong. Now at your shoulder joint up into my hand. 1, 2, 3, 4, 5. Okay, and then one up yet. 1, 2, 3, 4, 5. Same, and then now down. 1, 2, 3, 4, 5. Good. Now we're going to do thumb extensions, so don't let me move you. 1, 2, 3, 4, 5. And then now don't let me, now squeeze against my fingers like this, together. And don't let me pull my hands out, okay? 1, 2, 3, 4, 5. Great. Just do some reflexes while we're here. Okay. Okay. Now I want you to, again, push into my, just at the shoulder joint, push up. Yes. Good. And then just at the elbow joint, push up. Then push down. Don't let me move your thumb. Good. Don't let me pull out my fingers. Great. Keep yourself supported. We're going to go one leg at a time. Just at your hip joint, I want you to push up against my hand. Right there, perfect. 1, 2, 3, 4, 5. And now at the knee joint, push up into my hand. 1, 2, 3, 4, 5. And now at the ankle joint, push up into my hand. 1, 2, 3, 4, 5. Now down. 1, 2, 3, 4, 5. Push up into my hand with your big toe, yeah. Now just on this side, okay, right at the hip joint, push up. 1, 2, 3, 4, 5. The knee joint, 1, 2, 3, 4, 5. Back down, 2, 3, 4, 5. The ankle, 1, 2, 3, 4, 5. Down, 1, 2, 3, 4, 5. And just at the big toe, 1, 2, 3, 4, 5. Great. Alrighty, Tia, I want you to grab a finger, just your index finger, touch your nose, and then touch the tip of my index finger. And we're gonna go faster and faster and keep moving. Yeah, keep going. Good. Okay. Okay, let's switch. Okay. Can we go faster? Okay. Wonderful. Now we're going to have you alternate do this motion and just keep going. Yeah? Okay. Wonderful. All right, Ediya, so that concludes our head-to-toe exam today. We've got lots of findings here. For the most part, everything is looking really good. I have made a few notes on things that we should keep an eye on, like for instance, your tonsil on the left side and your ear on the left side. That's interesting to me now that I'm realizing they're both on the same side. Perhaps that is connected. So we'll just keep a close eye on that and see. It hopefully should resolve on its own. And we'll also keep tabs on how your sleep is doing and whether that supplement is helping you sleep blend. And I'll have some blood labs ordered for you for a more in-depth look at your health and your wellness. Is there any questions you have for me right now?
Not at the moment, no.
Okay, awesome. So I will see you again soon. Once the blood labs come back, I'll have you come in again. We'll go over everything and go over some recommendations that I have, okay? All right.
Thank you so much.
Thank you so much, Ediya. Take care now. Bye.